Hello everyone, my name is Dr. Krishan Mohan Kapoor and today we are diving into the basics of facial anatomy and its critical role in the field of injectable aesthetics. We'll also discuss the key differences between injection anatomy and surgical anatomy, two vital concepts that help us perform safe and effective treatments. Facial anatomy is incredibly intricate and dynamic. It encompasses several key elements including the skin, muscles, fat pads, nerves, blood vessels and bones. These structures not only define the appearance of the face but also guide our treatment strategies when it comes to injections. The skin on your face is the outermost layer, followed by several important underlying structures. Muscles that allow us to express emotions, fat pads that provide volume and contour, and bones that shape our facial structure. Additionally, there are blood vessels and nerves that need to be carefully considered to avoid complications like bruising or nerve damage or vascular complications. Understanding the topography of these anatomical structures is essential for any injector. Topography refers to how the various structures sit relative to each other and the surface of the skin. As injectors, our job is to navigate this map safely and effectively, ensuring that our injections are placed in the right layers to achieve natural and beautiful results. When we talk about injection anatomy, we are referring to the precise knowledge of where to inject within the different layers of the face. Injection anatomy is based on understanding depth, location, and structure. This means that while we perform injections, we rely on our knowledge of facial topography to accurately place the product where it will have the most benefit, whether that's botulinum toxin for muscle relaxation, fillers for volume restoration, or skin boosters for skin quality improvement. For example, when injecting Botox into the forehead, you need to understand the depth at which you should inject to target the muscle, ensuring the toxin reaches the right part of the muscle without affecting surrounding structures which are not needed. Similarly, with filler injections, you must be conscious of placing the filler at the appropriate depth in the dermis, subcutaneous tissue, or deeper into the supraperiosteal plane, depending on the area you are treating and the effect you want to achieve. Now let's talk about one of the most important aspects of today's video, the difference between injection anatomy and surgical anatomy. Surgical anatomy is the anatomical knowledge you rely on when you are performing surgery, which usually involves physically cutting into the body to gain direct visualization of the structures which are lying beneath the skin and subsequent layers. Surgeons often work with tissue dissection, cutting through layers to expose muscles, nerves, blood vessels, and bones. They have a clear, often magnified view of the area they are working in, which allows them to understand the structures in much greater detail. On the other hand, injection anatomy is about non-invasive navigation. Here we rely on our understanding of facial anatomy based on surface level topography and knowledge of depth without cutting into the tissues. Injecting is a delicate process where we have to anticipate the locations of structures beneath the skin and inject at the right depth based on our knowledge and the type of treatment being given. We don't get the luxury of direct visualization during injection, which is why understanding facial anatomy is even more critical for injectors. For example, while a surgeon might directly see and move the superficial temporal artery during a procedure, an injector has to know its exact location and avoid it when injecting into the temporal area. In short, surgical anatomy gives a clearer direct view, while injection anatomy demands careful planning, depth perception, and a solid understanding of how anatomical structures are positioned in relation to each other. So, what does this mean for you as an injector? A deep understanding of injection anatomy is crucial because it helps you avoid complications, ensures that your treatments are safe, and allows you to deliver the most effective results. For instance, in the glabella, we must inject Botox carefully in the corrugator supercilii muscle without affecting the eyelid area, which could cause unwanted side effects. When we are injecting cheeks with filler, knowing the depth and placement relative to buccal fat pad and zygomatic arch ensures that we are not injecting too superficially or too deeply, which could result in unnatural outcomes or complications. Similarly, understanding the vascular anatomy is crucial for preventing vascular occlusion or bruising. The infraorbital artery, for example, lies very close to infraorbital rim, and injectors they need to avoid this area when injecting near the under eye area. In conclusion, I want to emphasize that while surgical anatomy is incredibly valuable, injection anatomy is the cornerstone of your success as an injector. It is not enough to simply know the theory. You must develop a deep understanding of topography of face, muscles, fat, and vascular structures. This knowledge will not only keep your patients safe but will also allow you to achieve the most aesthetically pleasing results. Every successful aesthetic procedure, from Botox to fillers to skin boosters, relies on your understanding of the topographical map of the face. By injecting with precision, depth, and care, you can elevate your practice and ensure your patients get the best possible outcomes. Thank you for watching. I hope this video has helped you understand the importance of facial anatomy and how it relates to injectable treatments. Stay tuned for more detailed videos on specific area of facial anatomy and injection techniques in future tutorials.